Hello everyone. Today we'll discuss about regional odontodysplasia, or it is also known as ghost teeth. These are some other names of regional odontodysplasia like odontodysplasia, odontogenic dysplasia, odontogenesis imperfecta and ghost teeth. Coming to introduction, regional odontodysplasia, that is regional, that means it is localized, non-hereditary, developmental anomaly of teeth with extensive adverse effects on the formation of enamel, dentine and pulp. Coming to etiology, most of the cases they are idiopathic, but a number have been related to various syndromes, growth abnormalities, neural disorders and vascular malformations. Some proposed causations of regional odontodysplasias are also there, like abnormal migration of neural crest cells, latent virus can be latent in the ganglia, local circulatory deficiency, local trauma or local infection, hyperpyrexia, that is increase in the temperature, malnutrition or any nutritional deficiency, medication during pregnancy, radiation therapy and somatic mutation. Regional odontodysplasia carries an associated periapical inflammatory lesions. They are common. So, in dental caries also affected in case of regional odontodysplasia, and periapical inflammation like periapical granuloma, periapical cyst, these lesions also common in regional odontodysplasia. Because of dentinal cleft and very long pulp horns, pulpal necrosis is common in regional odontodysplasia. So, in regional odontodysplasia, enamel is involved, dentine is involved, as well as pulp is also involved. Then, most common presenting signs and symptoms of regional odontodysplasia. What are the signs and symptoms? First is delayed or failure of eruption. So the eruption pattern is delayed. If the normal eruption age is 6 to 7 years, for example, then in case of regional odontodysplasia, it will be delayed like 8 to 9 years or 9 to 10 years, like that. Or failure of eruption. Eruption is failure. There is no complete eruption of a tooth. Then early exfoliation. Early exfoliation, that means, for example, if a tooth, for example, the tooth of maxillary center incisor, they exfoliate around 5 to 6 years of age, in the deciduous tooth. But in case of regional odontodysplasia, there is early exfoliation of deciduous tooth. Then abscess formation of abscess, that is pus forming lesions are seen. Then malformed teeth. The teeth are not in aligned position. They are malformed. Non-inflammatory gingival enlargement. There is gingival enlargement. There is increase in swelling of gingiva, but without any inflammation. So these are some signs and symptoms of regional odontodysplasia. Then radiographic feature. So radiographic features of regional odontodysplasia is important because the name ghost teeth is occurring because of the appearance of the tooth in regional odontodysplasia under the radiograph. So the altered teeth, the teeth which is affected by regional odontodysplasia, The teeth that demonstrate extremely thin enamel. Enamel is extremely thin and dentine surrounding an enlarged radiolucent pulp. So pulp is enlarged and the enamel is thin, so it resulting in a pale wispy image of a tooth. So that tooth that appear as ghost teeth, it appears like a ghost. In the picture also you can see the enamel is totally thin, the enamel is looking radiolucency. So thin enamel and the increase in the pulp density, so it looks like a ghost, so it is known as ghost teeth. Then a lack of contrast is seen between the dentine and the enamel with an indistinct or fuzzy appearance. And in pulp, the enlarged pulps, they frequently demonstrate one or more prominent pulp forms. Next is histopathological features. Histopathological features comes under, one is ground section, another is histopathological section. In ground section there is no staining, no stain is used. So in ground sections the thickness of the enamel varies, that resulting in an irregular surface, and the prism structure of the enamel is irregular or lacking with a laminated appearance. The dentine that contains cleft scattered through a mixture of interglobular dentine and amorphous material. So the dentine that contains a mix of interglobular dentine and amorphous material. Some globular areas of poorly organized tubular dentine and scattered cellular inclusions, they also seen. Okay, so globular areas of tubular dentine and scattered areas of cellular inclusions. The pulp tissue under the microscope, it contains free or attached pulp stone that may exhibit tubules or consist of laminated calcification. This is a picture of histopathological stain. In this, the follicular tissue, you see the follicular tissue surrounding the crown may be enlarged and typically exhibits focal collections of basophilic enamel like calcifications, that is known as enameloid conglomerates. Okay, and this pattern of calcification is not specific for regional odontodysplasia and has been seen in other processes with disturbed enamel formation, for example amelogenesis imperfecta. Okay, so this pattern of calcification also seen in amelogenesis imperfecta as well as in regional odontodysplasia. And the scattered islands of odontogenic epithelium and other patterns of intramural calcification, these are also seen in regional odontodysplasia under the microscope. So coming to the treatment. So what should be the treatment for regional odontodysplasia? So first is to save the tooth or to keep the patient aesthetic. Okay, so first is the basic approach to therapy or treatment of regional odontodysplasia is directed toward retention of the altered teeth. First priority is to retain the altered teeth or retain the malformed teeth or affected teeth to allow for appropriate development and preservation of the surrounding alveolar ridge also. Okay, so next is your endodontic therapy. If the tooth is non-vital, then you can perform endodontic therapy, that is a root canal treatment that have been sufficient hard tissue is there and it allow restoration also. Next is unerupted teeth. Sometimes unerupted teeth also, they are under the radiograph you can see there is some changes. Regional odontodysplasia also affecting the unerupted teeth. Okay, it is not visible orally but it can be inside the alveolar bone. So in case of unerupted teeth, it should be remain untouched, restoring function with a RPD, removable partial denture, until the skeletal growth period has passed. Okay. Next is your erupted. If the tooth is erupted, so erupted teeth can be covered with aged retained restorations, okay, or stainless steel crowns, until final restorations can be placed after the completion of the growth of the patient. Okay. So because of the fragile nature of the coronal hard tissue, because the enamel is very thin, so it is very fragile in nature, and the ease of pulp exposure is also important. So tooth preparation is mostly contraindicated. Okay. So if the tooth is severely affected, and infected teeth need to be removed. If the tooth is severely affected, it is not retained, then it has to be removed. So these are all about regional odontodysplasia, the clinical features, the radiographical features, and histopathology, and the treatment part. For undergraduate, it comes as a short note as regional odontodysplasia or ghost teeth. Okay, thank you so much for viewing this video. Thank you.